want to welcome you. Our topic today is going to be about noise exposure and how loud is too loud. And so we're going to talk just a little bit today about, if you don't know who we are, we're going to talk about that. We're going to talk about healthy hearing. We're going to talk about why people are at risk for hearing loss and some of the implications of what that might mean. So I have a presentation today, but again, if you have questions or want to make a comment, please don't hesitate to do so as we go through the presentation today. So again, welcome is what I want to say to all of you. So let's talk about who we are, just in case you don't know who we are. At Complete Hearing, we have 3 doctors of audiology, myself, Dr. Au.D, and Dr. Sandra Miller. We run a private practice here in Lincoln, and we see patients of all ages, from 0 all the way up to 105. And so we just want you to know what we do here in terms of providing care is we see hearing loss, tinnitus, balance. We work with people who need some hearing conservation, meaning they need to protect their hearing because they work in loud environments. So just some of the different things we do here, and we have a great team behind us in terms of our staff is wonderful, and they all have a caring heart, and we're going to talk a little bit about what that means to you. Our mission here at Complete Hearing is really to provide you an unmatched hearing healthcare experience. And so we want you to have an experience here that you're never going to forget in a very good way. And we do that through our core values. We believe in selfless service and having a selfless staff and really having a selfless space. That simply means when you come to see us or any interaction you have with us, the solutions we provide are about you and how we can best take care of you. So I think it's important that you know what we do and how we do it. So you know who I am. In case you don't know who I am, that's my new look with my mask on. I'm from North Dakota. I have been in Nebraska for 27 years, so I kind of consider myself a Nebraskan, of course. I did get my master's from UNL, and I got my doctorate from audiology in Salus University. I've been practicing audiology for 25 years. Hard to believe. I've been in private practice with Dr. Au.D for 8 years, and so that's been a wonderful experience as well. I would tell you audiology and taking care of people is one of the most rewarding jobs you can ever imagine. So that's why I still love it as passionately as I did when I first started. I've been married for 25 years, and I have 2 adult children, Josh and Aaliyah. I have a British lab named Skylar. And on the side, what I like to do is I'm involved in my church in terms of women's and youth ministry, and I love to organize. So I like things that are clean and tidy. So that's just something so you know a little bit about who I am and what I do. Let's talk about what's an audiologist. Sometimes people have this question. We tell you if you've ever come to see an audiologist, we can have a whole entire session on what's the difference between an audiologist and a hearing instrument specialist. That could be a whole nother meeting. But let's just talk about what we do here at Complete Hearing as doctors of audiology is we really have a doctoral degree in the science and rehabilitation of hearing and balance. And we focus on the prevention and diagnosis and management of those systems. So when you come to see an audiologist, what you're going to be seeing is a very highly trained professional. We're all going to be certified by the state, licensed by the state. We do dispense hearing aids. We can go in and do interoperative monitoring with physicians. We're members of a cochlear implant team. Cochlear implants are something you might use when you can't benefit from hearing aids anymore. We talk about tinnitus. We talk about balance. So although a lot of people think of audiology and hearing clinic just being hearing, we do so many other things. So we just want you to know that. And where you're going to find an audiologist is typically in a private practice like we are. You might see one at an ear, nose, and throat physician's office, in the public school, at the VA, at the universities. You'll see military audiologists. You'll even see audiologists out, something called occupational audiology. Well, they'll go out and test noise in different field settings. So just so you know what an audiologist is. Let's talk about why noise exposure matters. And so there's 2 things I really want to point out here today is that when we have continual exposure to noise, it can actually increase your stress level. It can lead to depression. It can increase your blood pressure. And there's just a lot of health problems that are tied to being exposed to too much noise. And so we do live in such a noisy world. But what I want you to know is sometimes it's just really not good for your health in general. And then we talk about when you do have hearing loss, ultimately, if you have hearing loss because of noise exposure, you end up actually being more likely to have an increased likelihood to be hospitalized. When you have hearing loss, more likely to have falls, more likely to have dementia, and really just more diminished physical and mental health. And so those things are really, really significant. I want you to remember that. Some additional statistics that are important. 40 million Americans between the ages of 20 and 69 have high frequency hearing loss due to noise exposure. And that can simply be through, we think of noise exposure being military, or we think about maybe the construction worker, but there's many things that we do in terms of work things as well as leisure activities. It could be hunting, shooting, trap shooting. It can be, I love fireworks. It can be a lot of different things that can cause hearing loss in regards to noise. So we want to be aware of those activities that do cause some hearing loss from that. Of course, I think you'll probably understand that the majority of our soldiers come back and they do have some hearing loss because of being in the war zone, combat zone, firing firearms, things like that. And I think something that's really interesting is that they say 45% of young people who participate in musical groups or bands can suffer permanent noise-induced hearing loss. And so if you think about a couple of things, is that even if we're in like a band situation, depending on the music they're exposed to or how loud it is, it's a significant impact on their hearing as well. So we live in a very noisy world with lots of information. And on top of that is that we just have this ability that we're listening to it sometimes way too loud. So I'm going to talk about this because I think there's danger ahead. And that just means, I always say audiologists are always going to have hopefully a job, because sometimes our teenagers aren't very responsible when it comes to listening to their headsets. And so I think this is such an interesting thing that nearly half of teens are showing potential signs of hearing loss. And we'll talk about those signs in the future through the presentation today. And so just some risky habits they have in terms of not wearing hearing protection, or they wear their headphones way too loud. And so what does that mean? And we'll talk through that a little bit today. Headphones typically are too loud if somebody walks up to you and tries to talk to you and you can't hear them. You should still be able to hear conversation when you're listening to something through your headset. So I think it's something that our teenagers need to be aware of. And it's kind of just the beginning to think about what else could they be doing throughout their lifetime to damage their hearing, especially when it comes to noise. We're going to have a little anatomy lesson today, so I hope you all stayed up and studied last night. We just want to talk about the parts of the ear today so you have an understanding of why noise exposure happens. So this is just a little diagram. You're going to see in that diagram, the E is the external or outer ear, the M is the middle ear, and the I is the inner ear. And so our ear is really composed of three components when it comes to transfer of sound. So the ear canal, obviously the ear captures the ear, delivers sound down to the middle ear space. In the middle ear, that's your eardrum, the middle ear bones that just pushes sound down into the inner ear. So the inner ear is where we're going to see the damage happen that's going to potentially be permanent from noise. So we're going to talk about that today. Inside your inner ear, there's these hair cells, and they run the entire length of that little cochlea inside your inner ear. That's what we call the organ of hearing. It's kind of shaped like a snail. And each of those little hair cells, we have 40,000 of them in your inner ear. They get exposed to noise. And typically the high frequencies are going to get affected first, even if the sound is traveling through the lows as well. So what happens with that cute little diagram there is you see we have all these happy, normal hearing cells, and then loud sounds put a little damage to them. And what happens over time is if you get too much noise exposure, those little hair cells die and they don't grow back. I often use the analogy of if you were driving in the cornfield and you drove the same path over and over and over again, those little corn stalks that you drove over kept kind of getting weaker and then they never grew back. And so typically when it comes to noise exposure, you can have some temporary hearing loss, but you can also have some permanent hearing loss. One of the major reasons that you do have hearing loss in more of those high frequencies is I'm going to go back a page here. And we're going to talk about that letter E, the external ear canal. It actually has a resonant frequency. That's a big fancy word that simply means sound resonates at a frequency between 3 and 6,000 hertz. That's pretty high frequency. When sound comes into that ear canal, it gets amplified at those frequencies. And so what happens is the sound you're listening to is actually louder between that frequency range, which potentially causes more damage to the hearing. So that's why we typically see it in the high frequencies. Here's a great picture of what a normal cochlea looks like on the inside. So if you look along that band, it kind of looks like a snail, right? And you see all those little normal healthy strands or hair cells. And if you look to pre-hair cell death and you look to the next picture, which is on the right, of post-hair cell death. So it just honestly destroys those little sensors of sound. And that's why we get hearing loss. So let's talk about what's common, like how loud is too loud? I don't even know how loud sound is. We measure sound in decibels. That is just simply a measure of loudness. And so what you want to think about today is that, leaves rustling outside, 20, whisper 40, normal conversation 60. And as the levels go up, what you're going to notice is that it gets louder and louder and louder. And so we're going to talk about when is loud too loud. And so typically what we would say is 85 decibels is too loud. Well, how long can I be exposed to that? So we're going to talk about that today. So you're going to want to know when you go out and about, when am I exposed to these levels? And then, is it going to be damaging to my hearing? My favorite thing about the new Apple Watch is they have this decibel meter on my watch. And so when I'm talking right now, my voice is at about 69 decibels. Okay. Am I damaging my hearing talking to myself? No. But if you go into situations where you might find a real loud, ruckusy environment, you want to be sure you're safe. And so we need to talk about those safety levels. So as the noise gets louder above 85 decibels, that's when it becomes damaging. At 85 decibels, we can't have you be exposed for longer than maybe 8 hours a day consistently. That's a long time to be in that level of noise. But as the noises get higher, you're going to find we can be exposed less amount of time. So this is kind of noises can be loud. So this is just more on the higher end of what you want to think about in terms of decibels. So your washing machine is actually kind of loud. Traffic noise can be loud, but once we get up into that leaf blower area, we're at a sporting event, we go to a rock concert, or there's a loud siren, how long can we be exposed? And so once we get up to 90 decibels, look at if you were out, I always think about this during the summertime now where people are out mowing, they're using their leaf blower, their chainsaw, is that 2 hours of time is going to cause some significant damage. And so if people aren't putting hearing protection on, that's important. So if you see your local lawn mowing community out there, they're mowing the lawn and they're doing things where they don't have hearing protection on, that is definitely a concern. If you go to a Husker football game, that can get way above 100 decibels, but it's not for long periods of time. If we're cheering at 100 decibels for 14 straight minutes, hopefully that means victory for the Huskers. I don't know, but I just think that'd be a really long time. And then rock concerts, and as well as like if a siren is really loud. So just things to think about in terms of the louder it is, the shorter period of time you should be exposed to those types of sounds. So exposure time, here's a whole nother one that just kind of shows you, you dry your hair, hopefully not drying your hair for 8 hours, but that's kind of that level. And you can see as the hours go, or as the intensity goes up, the exposure time gets shorter and shorter and shorter. So this is just another graph to show you that, we can actually have some instantaneous hearing loss when it comes to maybe a firework or you're at a loud concert for a long period of time. If you've ever walked out of a concert and your ears felt numb or they were ringing, that would tell you there might be some potential hearing loss there. So let's take care of your hearing. And we talked about some of the things that can impact in terms of hearing. We talked about memory and dementia and conversations and all those things. And then just following with some statistics. And so 3 in 10 people over the age of 60 actually have hearing loss. And of course, it gets more common as you age. And that just means the aging process can be a part of it, but so many other things go into hearing. It can be noise exposure over your lifetime, medications you take, other actually health issues that you might have can really play a role in this as well. And so we want to make sure that we talk about the noise part of this, definitely, but also how does it encompass everything else and the impacts that it does have. So let's talk about if you have symptoms of noise-induced hearing loss, what does that mean? I kind of just used the example. When I left a concert, everything just sounded muted and muffled. If you're starting to notice muting or muffling of sound, definitely that could be some potential that if you're exposed to some noise, that could be a potential for hearing loss. If you aren't hearing the high pitches, the birds chirping, the crickets outside, the telephone ringing, speech kind of sounds like this instead of being very clear and being able to understand. And then, of course, ringing is another one. Ringing in the ears is a significant sign of potential hearing loss. So if you start to experience some of these things and you've had some noise exposure, even if you haven't, these are some early warning signs. If you don't know what tinnitus is, this is ringing in the ears. So people describe it as a hum or a buzz or a roar. It can be always there. It can be intermittent and super annoying. I mean, if you've ever had it, you definitely like, I don't want to have this anymore. It can get better over time, but oftentimes it doesn't completely disappear. And the more noise you're around, the potential is that tinnitus can actually get louder. So when people come into us and they say, I have ringing in my ear, we're going to determine, is there any hearing loss? And then the second thing we're going to do is say, okay, we want to make sure you protect your hearing. How do we talk about doing that? Another thing that can happen is hyperacusis, and this might be a word you're not familiar with. Hyperacusis means I'm hypersensitive to sound. So I want you to think about those little hair cells we talked about in the ear. When they get damaged, they can sometimes get really sensitive to sound. And so when something becomes super loud, or it's kind of normal and then it gets super loud, that's kind of an abnormal perception of that loudness sound. And that's just your ear reacting to damage. And so typically, if people have severe hyperacusis, they just can't even handle normal everyday sounds and they just want to put some earplugs on. But this can also be another sign that you may have a little bit of hearing damage. So what happens when you have hearing loss from noise? You can have something called a temporary threshold shift. Big fancy word that just simply means, oh, let's see, it was 4th of July, we got together, the firecracker went off, and my ear started to ring and it was super muffled. You came to see Complete Hearing and we got you tested right away. And we say, okay, there's some hearing loss, but now we're going to see if you get any recovery from that. We might have you come back a couple weeks later just to see, you know what, those little hair cells I told you about that kind of slowly die off, sometimes they can slowly die off and then recovery can happen. It's different for everybody. And so typically that's what we hope happens when there's noise exposure, but it just really depends on the integrity of the ear. It depends on you as a person. And so, but we would tell you repeated things like that over time can definitely cause permanent hearing loss. So temporary threshold simply means my hearing went down and then it came back. And for a lot of us, that may have happened when we went to a concert or we did something where there was an event where we thought we didn't hear very good afterwards or our ears rang. And then when it slowly came back and your ear recovered. But again, we don't want to do that over and over and over again. Then we have a permanent threshold shift. And that just means permanent hearing loss has happened. Those little hair cells that were sensing sound, they slowly died off and then they didn't recover. And so repeated exposure over time happens. That's definitely what happens. So sometimes we see people who are in the military, or we see people who work construction, or people who are constantly exposed to noise over time. If they're not protecting their hearing, this hearing loss definitely can become permanent. And once hearing loss is permanent from noise exposure, or we do have this type of, we call sensory hearing loss, it doesn't come back. We can't give you a medication or a surgery to make it better. So let's talk about hearing protection. So even though many musicians are aware of the dangers of noise exposure, and a large population of people are very well aware that noise is not good for you, why don't they wear hearing protection? It's kind of always our question. Why is that? And I think a couple of things happen is that they're not, we don't know. What kind of hearing protection should I wear? What's most appropriate for the application that I have? So today we're going to talk about some different kinds of hearing protection, the pros and the cons to each one. And then we'll talk about maybe if you have questions about that this is my environment, what's best for me, we are glad to consult with you in regards to that. So let's talk about taking care of your hearing. You've seen these foam earplugs that you can buy over the counter. You've seen the earmuffs that you can put over the ears. And believe it or not, we make custom hearing protection as well. So there's lots of choices. And so the question is, what am I going to be doing? What's the most appropriate solution? How much protection do I need? And so these are some of the things you definitely want to consider when it comes to that. Foam earplugs. There are some many positive things about that. They're disposable. So if you know somebody who works in a factory or in a job that requires hearing protection, they may just have these little foam earplugs. They squeeze them in, stick them in your ear, and you wear them all day, then throw them away and put a new set in. Nice. They're inexpensive. They attenuate some good noise. They're comfortable for some people. And they're great to use kind of during these sporting events or loud concerts. You see sometimes even when people bring their babies to the NASCAR race or they bring them to a loud sporting event, that's why they're putting hearing protection on them. Some negatives about these is that it attenuates a lot of sound, so it drops everything down. This isn't a good option for musicians. Musicians want a flat attenuation and they want it to be still have fidelity. And so this isn't always a great option for musicians. They're not fit for everybody. If you have a curvy ear, if you have really small ears, this might not be the best option for you. And if you're taking them in and out or using them not as disposable, you can put some dirt into your ear as well, which is not good for your ear either. Let's talk about the pre-molded, kind of these, I always call these the Christmas trees. These are more one of my favorites that you can buy over the counter. They come in different styles, different sizes. They're soft, they're flexible, and they can be reused. So you can clean these off and put them in and out. They have a nice string around them, so when you take them out, they kind of lay around your neck. And again, this kind of goes back to sizing. Some of our patients just come in and say, I've tried every earplug I possibly could do through Walgreens or wherever they bought them disposable, and it's just not fitting. And so we try to find a good solution like this, or we may talk about doing something custom. Earmuffs, easy. I love this option, right? Easy is good. It covers the whole ear, which is a great thing. Long lasting. So they tend to be a little more expensive potentially than maybe something that's disposable. It takes less time to squeeze them in your ear and get them. It's pretty easy to put a headset on. Most of us are familiar with that. So it's not like you have to have a small, medium, or large. We can have them for maybe pediatric size, and adult size would be most appropriate. But when it's hot, these are not great to wear. So maybe you're out going to be doing some trap shooting and it's 90 degrees outside, or you're at a sporting event and it's really, really loud, but it's like 90 degrees. Sweating, not as comfortable, can be cumbersome. And then, of course, it messes up your hair. And if you have glasses or sideburns or things like that, that can actually impact how well it seals on the ear. And it can also impact the protection that you're going to get. Musicians' plugs, and I would tell you, we're going to maybe dive into this a little bit. What we find is when our musicians come and they want some hearing protection, again, they want fidelity. The benefit to this is they're custom made. And so think about those ears that might not be as straight, or they might be narrow. This molds to the ear. So it's hearing protection that fits comfortably, but also designed for what people need. And so you can get them in multiple colors. They're long lasting. And so when we custom make something for you, it's going to last a long time. So it's really definitely worth the investment. And what's nice about it is it gives a reduction for musicians that can be more customized to what they're doing. You might have a percussion player who needs more attenuation than maybe somebody who plays violin or maybe plays a different instrument. So depending on where that person might be sitting in the orchestra or band, what is the most appropriate attenuation for them? So this is a wonderful thing where we can more customize it to the need of the person. They are more expensive because a couple of reasons. They're more customized. And then, of course, if we're taking an impression and custom making them for you, you're going to have the investment of somebody coming to help you with that too. So one of the audiologists here would just simply take an impression, try to find the best solution for you. And then we have tons of options when it comes to custom plugs. We have hearing protection that you can use for sleeping. So if you have a snoring spouse, we can make them for that. We have active filter systems, which means I want to wear them for maybe trap shooting, but I want them to activate when I shoot my gun, but I want to be able to hear the other people on the range when I'm there. We have hearing protection for that. And so depending on the use of what people might need them for, we can definitely customize them to those needs. Our goal always is when we talk about hearing protection is we want to hear from you and the patient. What do you need these for? What kind of use are they going to have? Is it something we just need to have it as being disposable, or is something that we need to do more custom because of the shape of the ear or your needs? So there's lots of things to consider when we talk about hearing protection. Our goal definitely is that we want to provide education in preventing hearing loss. Ultimately, we would hope that we wouldn't have people having hearing loss. And if we can prevent it, that would be the number one thing for sure. And I think we live in such a noisy world that there are people out there who just don't realize how much damage they are doing to their hearing based on what they do every day. So the most important thing you can do, honestly, if you have some of these symptoms that we talked about today, is that you just need to get an exam. So if you haven't had your hearing evaluated, we need to do a comprehensive exam. What does that mean? Well, why can't I just do a screening? If you do a screening, that's going to be kind of a pass-fail. Do you hear the beep or don't you hear the beep? When you come to see us, we're going to find out, do you have hearing loss? You have these symptoms. Where else could that be coming from? And then if we do a comprehensive exam, we can detail in exactly where did this hearing loss come from. Because if you have hearing loss due to noise exposure, you're going to have a certain shape to your audiogram that we can very easily identify. Maybe it's something else that we need to be concerned about. So we need a comprehensive exam to make sure that we just don't say yes or no. We say, what are the details? So we understand that. A baseline is important. So if you know somebody who is just like, I'm not sure if I have hearing loss, I'm kind of nervous because what if I go in and they tell me I need hearing aids? Not everybody who comes to us needs a hearing aid. And so we want to make sure we always evaluate, get a baseline evaluated, and then make a decision from there. I always tell our patients, when we see patients here, like, you don't know what you don't know. And if you're starting to have some of those symptoms and potentially have a noise exposure history, there's long-term effects to not getting that evaluated. So you need to treat your ears like you treat your eyes, like you treat your teeth, making sure that you get those evaluated because it's such an important sense that we want to protect. And so we want to make it important to you, of course, and then we want to protect it when you're at home or at work. So things you just want to think about when it comes to hearing loss and hearing protection. We're going to take some time if you do have any questions for me today. If you have any things you want to chime in about, we'd be glad to take some time for those questions today. We have a great team here available to do that today as well. So I think it's just, it's one of those topics that I think people don't think that much about. And I would tell you now that we're getting into the summer and we're thinking about mowing lawns and we see our construction workers out and we're doing things that are just honestly more noisy to make sure that we protect our hearing. And I have a lot of our patients who might be even wearing a hearing aid. One of the questions they will ask is, should I wear my hearing aids in this environment? And I always say that depends on what you're doing. But if the noise levels are getting to a level that are uncomfortable or you feel like this might be too loud for me, protect what you have. If hearing protection is appropriate, we definitely want you doing that during that time. Awesome. 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 So if you have questions, unmute your mic and go ahead and chime in if you want to. Couple things I would say about Coffee and Conversation that we're having is I want to thank everybody who attended. We're going to try to do this monthly like we've done before. We hope to get you back into our space, but we actually love this, that you can, for those of you who are new to Zoom or Zooming is now kind of part of your life, it's definitely has its advantages. We'd rather be drinking coffee with you right now or maybe having a snack. But we just enjoy the fact that you took some time out of your day to do this. If you haven't gotten we have our topics all listed out for the year. And so we have, I'm asking Amy right now where they're listed. We have them. If you haven't gotten one of our little cards it's like a ticket to come to the conversation, they are listed. They're listed on the website. See? So if you're ever wondering like, hey, what are they going to talk about next month? We're always going to be inviting you to come to the meeting. We may actually do this way. We might do Facebook Live. It's just a different way to do things. But that way, you'll know what the topics are coming up. And sometimes we actually have guest speakers. So sometimes we have some things on the schedule that I think you'll be excited about, because I love when we have people come in and talk about things that are relevant to what we do. We might have a clinical psychologist come in, a pharmacist. So just some of the things that we know that are important to you. And then also, if you're wondering, how can I schedule an appointment with Complete Hearing? You might want to know that. Lots of different ways to do this. The simplest way is simply call us, 402-489-4418. Check out our website. You can either get all your information there, and you can actually book an appointment online as well. So those are great ways to reach out to us. And you're just having general questions. I would tell you the most important thing we can do for you is provide you education. That's why we're here. And if we have solutions, we're here to provide those too. But ultimately, we just want to listen to what you need. And we will be able to provide that solution to you. All right.
A question about, you mentioned a medication that might be contributing to your hearing loss.
Yes.
Can you give an example of that?
I do. We need to post that. So we have a brand new list of kind of a list of general medications that you could potentially be taking that could be damaging to your hearing. So a couple things that you want to think about is, do I take an aspirin every day? Okay, and a lot of people do. We want to make sure that the dosage is not too much. So if you're taking a baby aspirin and you're taking it once a day prescribed by your physician, great. What we want to make sure is you're not taking lots of aspirin, because sometimes people think more is better. And so if they take lots of aspirin every day, it may contribute to ringing in your ear, and it could potentially cause hearing loss as well. Sometimes when you take high-dose antibiotics, you take a diuretic, it all depends on what medications you take and how they're interacting with each other. And so it really is to say, are these medications toxic to my ear? And even people who take like cancer medications. So if you're on some type of treatment, this is so great. My team is helping me out here. We have a new sheet called ototoxicity, and kind of just some general ideas for you. And most importantly, what I would tell you is, when you take one medication, that's one thing, but when you take multiple medications, and how do they interact with each other and the side effects that are potentially there. So for most of our patients, when we ask you for your medication list, we're looking to see, is there anything that you're taking that might be interacting with other things? And it can simply be some things that you take as a medication, but also what might be over the counter, and how do those interact with each other? Because everything has a side effect most of the time. There's going to be some type of side effect. We want to make sure that any of the symptoms you're having or any decline in hearing you're having, is that attributed to something you might be taking in terms of medication? So Antibiotics, anti-inflammatory, cancer medications, pain relievers, diuretics, things like that. And so it's not necessarily that those things are bad, but if they're taken too much of it or they're taken in conjunction with another medication, that could potentially be damaging to your hearing. It's a good question. Thank you.
So would your primary care or whoever you use, would they be tuned into that as well?
I love that comment. What I would tell you is the best person you can check with is your pharmacist, because your pharmacist, if you have, so in the old days, what happened is your doctor was with you when you were born until you died, right? We had one doctor. Well, now we have a doctor because we have heart condition, we have an internist, we have a cancer, like we have multiple doctors now. If you're pharmacying at one place, then I would ask your pharmacist. And if you're going to multiple pharmacies to get your medications, I'd have the lists printed, and then I would take them to a pharmacist and I would say, I'm taking all this medication. Can you tell me? Because they're going to have a pretty good idea of, because your primary care may not know all the medications you're taking if you have multiple doctors. Does that make sense?
Yeah.
Sometimes they're not, we talk about they're not communicating with each other. And so your pharmacist might be the core person who has all that information. I take these 5 medications from these 3 doctors. Do these have the potential to interact with each other? Or I'm having these symptoms. Is that something I need to be concerned about? That's a great person to check with. However, if your primary care is the only doctor you have and he knows everything about you and he knows your med list, that's another good person to check in with. It's a good question. Really good question. We actually did we do a radio show called The Conversation Starts Here. It's on our website. And we did a podcast with a pharmacist, and we talked through all of these things. And kind of like, in the time of COVID, there were things coming out saying, well, you should take quinine, or you should, there were these things coming out, or what should you take? And as audiologists, we were saying these medications they're talking about actually are toxic to the ear, depending on how they're taken and what they're interacting with what somebody else might be taking. So our job obviously is to hopefully keep you informed, but I loved your question. Pharmacist or primary care were the places where I would go.
Okay, thank you.
You're welcome.
When a person that already wears hearing aids is mowing the lawn, then should they put on something for protection? Leave those hearing aids in?
My comment to you about mowing the lawn is hearing aids off, okay? Because you're out mowing the lawn. We don't want the hearing aids. They're not going to over amplify sound for you, but they're going to pick up dust and dirt and what if you sweat, things like that. And it's loud enough that you should just take those hearing aids off, put them away, and put some hearing protection in. You want to make sure you protect what you have.
Okay, thank you.
Yeah, great questions. So my question is, have you guys been Zooming? Is this something new for you?
For me, I've just done it since COVID things.
What do you think?
Pardon?
What do you think of it?
For the most part, it's been helpful.
Yeah, good.
Our choir director at church decided that we all needed to be connected because there's about 20 in our group and we were missing each other.
I bet you were.
We can't sing, but we can be connected.
Well, I think you could sing on your Zoom. I don't see anything wrong with that. It might not harmonize right, maybe. I don't know.
If we could stay together.
I'm doing a study from our church starting this afternoon for about 5 weeks on Zoom.
I love that. What are you going to do?
I have a couple other things. I go to a water exercise class, so I did. And so we always had coffee every day after class. And so now we meet on Monday and Thursdays at 8 a.m. online to chat. And I have another small group at Tuesday mornings at 8. So it's a lifesaver for me.
Oh, I want to tell you, I say technology is awesome. Can you imagine having what's been going on in our world and not being able to have this? We would feel even more isolated. So I give mega kudos to both of you who said, yeah, I can still connect. And this is a way to connect. We still miss that person-to-person contact, but we definitely can still have a conversation, which is wonderful.
Yeah.
That is wonderful. I'm grateful for that. Well, I just truly appreciate you tuning in because it's been very helpful to have this is our inaugural. Is he going to peek in? Is that Dwayne? Hey, Dwayne.
He's talking instead of listening.
How come you got such a little screen?
How are you?
Fire and hot.
It's hot. I know it is hot. It is hot. Awesome.
Dry.
Well, we're going to continue to invite you. So again, next month, and again, you know how to reach out to us and contact us, and then making sure that we'll keep inviting, and we hope we can get you back into our space soon. But until that time, we'll just connect the way we can.
Are we? Is this the first time you've done it, or have I missed some?
Nope, this is the first one. So, pardon me, I'm going to cough. Our lobby's been closed, and so we were trying to, let's just think outside the box. And we're like, duh, we could totally do this and have it, put the information out there, and just, it's honestly, I really love this because it's, sometimes it's not convenient for people to come over, even though, even before COVID, sometimes they're like, Sandra, you have this at a time where it's not convenient for me. So if we can make this available via video as well, we're finding sometimes this might be more applicable for some people. So you are on the inaugural Zoom Coffee and Conversation. Congratulations.
Okay, am I understanding that when I need batteries and et cetera soon, that I call first and then come, or can I just come?
Susan, what I would tell you, a couple things is that we would like you to call because then we can be prepared. But if you simply drive up, you're not going to be able to still get into the door. So just the numbers on our front door, you call and we'll bring them right out to you.
Okay.
So
Okay.
Yeah. So for some reason, you're like, I forgot to call them and tell them I was coming. If you drive up to the front door and do call us, we can get everything ready for you.
Okay.
So I think you probably got our email, maybe that we have curbside walk-in hour back now.
And I saw that.
Yeah, our patients really miss that. And we were talking about how it's hard for you to leave your devices with us and then come back in 2 hours later. So that we just, it's nice because we don't know how, we were kind of trying to figure out how busy is this going to be. So if we have an expectation of kind of who's coming, it helps us prepare better and get you kind of processed through a little easier.
And it's just the normal 11:30 to 12:30.
Yep, it is. We have you wait until you see what's coming up. We have a little number system. We put it on your window so we know what car is car. And then we're going to be coming up with some ideas about having, I don't know, Ice Cream Friday and music out front. We're trying to make this, we're so excited just to get people, we just want to see you. We miss you. And so, you'll see some new ideas coming out as well.
All right. Thank you.
All right. You're welcome. All right. Well, I'm going to sign off. There's something else you need, you know how to get a hold of us, and we will go from there.
Thank you very much.
Thanks for your time today.
Thanks for your time.